Epogen Vial is used to treat anemia in people with chronic kidney failure, those receiving zidovudine for HIV, and those undergoing chemotherapy for certain types of cancer. It may also be used to reduce the need for blood transfusions before certain surgeries with a high risk of blood loss. This medication works by signaling the bone marrow to produce more red blood cells, similar to the natural substance in your body that prevents anemia. The daily dosage and timing for taking this medication should be determined by your healthcare provider. Before using Epogen Vial, it's important to read the medication guide and patient information leaflet provided by your pharmacist. If you have any questions, ask your doctor or pharmacist for clarification. This medication is typically given as an injection under the skin or into a vein, as directed by your doctor, usually 1 to 3 times a week. If you are receiving this medication before surgery, your doctor may have a special dosing schedule for you. For hemodialysis patients, this medication should be received by injection into a vein. If you are using this medication at home, it's important to learn all the preparation and usage instructions from your healthcare professional. Before using Epogen Vial, make sure not to shake the medication. Check the product visually for particles or discoloration, and do not use the liquid if either is present. If you are injecting this medication under the skin, be sure to clean the injection site with rubbing alcohol before each dose. It's recommended to change the injection site each time to lessen injury under the skin. The dosage of Epogen Vial is based on your medical condition, weight, and response to treatment. Blood tests should be done often to check how well the medication is working and to decide the correct dose for you. It's important to consult your doctor for more details. In order to get the most benefit from this medication, be sure to use it regularly on the same days of the week as directed. Do not increase your dose or use this drug more often or for longer than prescribed, as it will not improve your condition any faster and will increase your risk of side effects. It may take 2 to 6 weeks before your red blood cell count increases. Be sure to tell your doctor if your symptoms do not get better or if they get worse. Possible side effects of Epogen Vial include headache, body aches, cough, or pain at the injection site. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks. Many people using this medication do not experience serious side effects. Epogen alpha may occasionally cause or worsen high blood pressure, particularly in patients with long-term kidney failure. To prevent this, your blood pressure should be well controlled before starting treatment with this medication. It's important to monitor your blood pressure regularly and make any necessary dietary changes or medication adjustments as advised by your doctor. In rare cases, this medication may stop working effectively over time, leading to a serious anemia. If you experience symptoms such as increased tiredness, low energy, pale skin color, or shortness of breath, notify your doctor immediately. It is important to seek medical help right away if you experience symptoms of a serious allergic reaction, including rash, swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you experience any other effects. It's important to talk to your doctor about the risks and benefits of using Epogen alpha. This medication may rarely cause serious side effects, including blood clots, heart attack, stroke, or heart failure. Your doctor will need to closely monitor your red blood cell count and hemoglobin level, so it's important to keep all lab appointments. The lowest effective dose of this medication should be used. When using Epogen alpha to treat anemia related to cancer, it may also increase the risk of death and/or cause your tumor to grow faster. Your doctor will need to direct when to stop this medication after completing a treatment course of chemotherapy. Before using Epogen Vial, make sure to inform your doctor or pharmacist if you have any allergies to Epogen alpha, other similar drugs, or any inactive ingredients in the medication. It's also important to discuss your medical history, including conditions like high blood pressure, heart disease, seizure disorder, or severe anemia caused by past erythropoietin-type treatment. Some forms of this medication are made from human blood, so there is a very small chance of getting infections. Your doctor or pharmacist can provide more information on this. Additionally, if you have phenylketonuria, PKU, or any other condition that requires you to limit phenylalanine in your diet, consult your healthcare provider before using this medication. Before undergoing surgery, it's important to inform your doctor or dentist about all the medications and products you are using. If you are pregnant, this medication should only be used if clearly needed, so discuss the risks and benefits with your doctor. It's also important to consult your doctor before using this medication if you are breastfeeding, as it is unknown if the medication passes into breast milk. It's important to be aware of potential drug interactions with Epogen Vial, as they can affect how the medication works or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Epogen Vial. If someone has taken too much Epogen and experiences severe symptoms like losing consciousness or difficulty breathing, it is important to seek immediate medical attention. In the U.S., you can call the local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important not to share this medication with others. While using Epogen Vial, you will need to undergo lab and/or medical tests, such as blood pressure and a complete blood count that includes hemoglobin level. It's important to keep all medical and lab appointments and consult your doctor for more details. Your doctor will also conduct blood tests to check your iron levels and may prescribe iron supplements for you to take. They may also recommend that you eat a well-balanced diet rich in iron, such as raisins, figs, meat, eggs, vegetables, and iron-fortified cereals. It's important to follow your doctor's instructions and dietary recommendations. If you forget to take a dose, it's important to speak with your doctor or pharmacist to get a new dosing schedule. Never take a double dose to make up for the missed one. It's important to store Epogen Vial in the refrigerator, but do not freeze it. Keep it protected from light and store the medication in the original carton until you are ready to use it. If you have the single-use vials, make sure to discard any unused medication right away. For the multi-use vials, store opened vials in the refrigerator and discard any unused medication after 3 weeks. It's crucial to keep all medications away from children and pets. When it comes to discarding the medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.